adequate, and the blood pressure and heart rate are typically unchanged. So it just represents a little bit deeper level of sedation, but again, without significant physiologic changes.
Now, am I correct in assuming that most hospitals or pain clinics, for a person to be able, a doctor to be able to use conscious sedation, are they required to take any classes or be certified or any tests?
Yes, anesthesiologists are obviously trained in conscious sedation and managing all the physiologic responses. But for non-anesthesiologists to use these type of drugs, midazolam and propofol, most hospitals require a certification procedure for performing conscious sedation, just so that they are aware and capable of managing the expected or predictable the expected or predictable side effects on various physiologic responses should patients inadvertently become more deeply sedated. As we say, you should be able to rescue the patient from a deeper level of sedation than you intend to achieve because of the individual variability. You can't always be sure that a given dose is going to achieve a response, and so you have to anticipate that it could produce a greater response and be appropriately trained and knowledgeable to rescue the patient from that situation.
And you are aware of the fact that Dr. Murray is...
Yes. May I, please? Thank you. Dr. White, did you retrieve what you had to?
Yeah, but it was returned. I guess I don't need it.
Good night, folks.
You may.
Dr. White, do you have in your possession Dr. Murray's documents regarding his certification to use conscious sedation?
Yes, there is a certification from, I believe it's Sunrise Hospital and Medical Center in Las Vegas, demonstrating that he has been approved to administer moderate sedation analgesia, which would be conscious sedation.
Thank you. Your Honor, I'd like to have these documents marked as
Quadruple Hotel.
H. Now, I'd like to referring to HH. Would you explain what certification allows for, as it relates to conscious sedation, or I guess it's also termed moderate sedation?
Here at the top. What is your question? I'm not clear.
What does the certification for conscious sedation allow you to do?
Well, I think it says qualified individuals are trained in professional standards and techniques to evaluate patients prior to administration, administer pharmacologic agents to predictably achieve the desired level of sedation, which is moderate sedation, monitor patients carefully in order to maintain them at the desired level of sedation, rescue patients from deep sedation. That's the idea that you can bring them back from a deeper level than anticipated because of the well-described variability. Manage a compromised airway. That's when some patients develop airway obstruction or they should stop breathing for some reason. And provide adequate oxygenation and ventilation for patients who develop apnea or stop breathing.
Thank you. Now, I want to move on to some more of Dr. Schaefer's simulation. I want to refer to the chart that's previously been marked as BBB and ask you, doctor, do you recognize that sawtooth diagram?
Yes, I do.
Is that basically what Dr. Schaefer provided in his medical report on in April to explain how to get to a 0.16 lorazepam level in the blood at time of death?
Here. Yes, it is the graph that he provided in that letter document, but he has recently modified it.
Well, the modification...
Because, as you can see, it actually gives the first dose of lorazepam in the simulation at 12 midnight when Mr. Jackson was still at Staples Arena. And according to the report, he did not arrive home until sometime around 1 o'clock. So unless he got a second dose while he was in transit from Staples, it's really not a very accurate simulation.
Well, he indicates in his report that this is based upon the fact that there was a 40 milligram vial that was found empty at the scene. Is that correct?
I assume that was the rationale for...
Objection calls for speculation.
The objection is sustained. The answer is stricken disregard.
Well, Dr. Schaefer, in fact, said that...
Objection. Dr. Schaefer's testimony stands on its own. It's not this witness's job to...
You can ask a question.
Dr. Schaefer, in his report, indicated that he came up with 4 milligram doses 10 times based upon a 40 milligram vial that was found empty in the closet at the scene. Is that correct?
That was my understanding from reading his report, yes.
And so those 10 injections, they equal 40 milligrams?
Well, if you give 10 4 milligram or 1 cc injections of lorazepam, that would equal 40 milligrams, correct.
Now, would that be a medical dose? Would a doctor do that?
Objection. Relevance calls
It's
for
vague and
speculation.
ambiguous. Sustained.
What would be the effects of 4 milligrams given every half hour for 10 injections on a patient?
Well, in the average patient, they would probably be dead, but they, at the very least, would be comatose for many hours.
Now, Dr. Schaefer has subsequently corrected.
I shouldn't say they would be dead, excuse me. It's possible. It depends on the size of the patient and their medical condition, but it represents an enormous amount of lorazepam. That's all I want to say.
They'd definitely be asleep, wouldn't they?
I cannot imagine anyone who would not be asleep after receiving 40 milligrams of lorazepam over a 5-hour period.
Now, since preparing his report and since his testimony, has Dr. Schaefer corrected this diagram? Next in order is H.
I think he's changed.
Your Honor, it calls for speculation. Dr. Schaefer, the evidence speaks for itself.
I'm going to sustain the objection to the form of the question. The partial answer is stricken. Do you have another exhibit you want? Quadruple India?
Yes.
It's marked.
Now, is this a recent modification of Dr. Schaefer's original diagram prepared in his report?
Yes, I think I was shown this diagram last week, or a week
And-
before.
And the adjustment here is two ways. He's moved the time from 12 to 1:30,
Yes.
and he's changed the doses from 10 down to 9.
Yes, he dropped one of the doses.
Now, the 9 4 milligram doses wouldn't fit with a 40 milliliter vial being all used up, would it?
No, but I think the reason the number of doses was reduced is because he has to end up with a expected concentration in this range at the time of death, which was on or about 12 noon.
Okay, well, whereas the original sawtooth diagram of the 10 4 milligram doses based upon the fact that there's a 40 milligram vial empty has now been changed to get enough doses to end up with the .169 at time of autopsy. Is that correct?
Yes, but you can come up with any number of simulations by working backwards from a specific concentration. And that's basically what he's done with the simulations.
I have another diagram I'd like to mark as